Dear friends, and ladies and gentlemen, it's really a great pleasure and honor indeed for me to be here on the platform of Medanta Moolchand Heart Center, New Delhi, India, on a very special occasion. And the occasion is World Heart Day celebration on September 29th, 2025. What is the theme this year? You all know the theme. Don't miss the beat. But if you see in detail, the theme of 2024, 25 and 2026 to be continued. And what is the theme? Use your heart in action. What is our main objective of this celebration of World Heart Day? The main objective is to enhance the awareness of a healthy heart, right from childhood to adulthood to even old age. Everybody should be healthy. None of us should be unhealthy. We must enhance the awareness on heart wellness, and there should be a paradigm shift from heart illness to heart wellness. I firmly believe that if we really want to celebrate the World Heart Day, we should focus on primordial, primary, secondary, and tertiary prevention. And we should also focus on predictive cardiology. I firmly believe that preventive cardiology and predictive cardiology are the mainstay to have a healthy heart in the years to come. When I talk of preventive cardiology, I told you all the modes that we must not have the risk factors. So before the risk factors, after the risk factors are there, and then after the disease is there, what we should do, what we call as primordial, primary, secondary, and tertiary prevention. Now, in the primary prevention, our objective is to control the risk factors. We must make sure that none of us should have a unnecessarily stress or negative stress. So there are 7S. One is stress. Number 2 is smoking. Number 3, sedentary lifestyle. And number 4, saturated fat. Number 5, salt. Number 6, sugar. And number 7, sleep inadequacy. So 7S, please say no to it. If we control these 7S, I'm sure to a very large extent, we can prevent heart problems and we can keep our heart healthy. Number 2, how do we predict whether an individual is a victim of a premature heart disease or not? The answer is everybody should go for a health checkup at least once in a year from the age 20 onwards. And when I say health checkups, it should comprise of clinical, for example, heart rate checkup, blood pressure checkup, and even the waist circumference, which is very important. If the abdominal circumference is more than 90 centimeters in men and more than 80 centimeters in women, we call it obesity. So we have to prevent obesity. Sometimes we do what we call ankle brachial index. So these are all the clinical variables which we always consider because a lot of people in India are having a hypertension at a very young age. Heart rate variability, BP variability, and even the cholesterol variability are very, very important. What is number 2? Number 2 is how should we investigate the people? We must do blood work, which comprises of hemogram, also blood sugar, lipid profile, LFT, kidney function, thyroid function, HSCRP, in some individuals homocysteine levels or some specific emerging risk factors. We should also do ECG as a routine, and echo is a very, very important investigation as a checkup. I call echo as the third eye. We can see everything within the heart. and outside the heart, especially the epicardial fat. And we can see all the functions of the heart, the structure of the heart, everything will be very beautifully evaluated. And now, these days we also do what we call as CT coronary angio, which is also a very, very powerful tool. And the calcium score from 0 to for 0 score is a normal, and then 1 to 99 is stage 1, 100 to 200 stage 2, 200 300 stage 3, 300 to 400 stage 5, and beyond 5 people with a high score, and they may have vulnerable plaque or non-vulnerable plaque causing premature coronary artery disease. So all these things should be worked up. So health checkup camps, health checkups as a whole with investigations, and elimination of risk factors by lifestyle optimization is the need of the hour. Ladies and gentlemen, very important thing. We should always make sure that we don't fall victim to air pollution, noise pollution, water pollution, and even victim of so-called mental pollution. So all these things should be avoided. We should remain healthy by practicing meditation on a regular basis and practicing yoga. All the 8 limbs of yoga to be practiced. Yama, Niyama, Asana, Pranayam, Dharana, Dhyana, and Samadhi. If we have a perfect lifestyle, we are going to be healthy. Lastly, ladies and gentlemen, a very important message for you. All of us should be disciplined 50%. 25% persistence of discipline. 15% mindset. What is left? Only 10%. Hard work 5% and 5% of smart work. If you follow this formula, I am sure we are going to be healthy at least till the age of 90. After 90, it's God's will. A time has come, we should know that health of the heart is in our own hands. Heart attack or health of the heart is a matter of our own perception, our own thoughts, our own interpretation, our own experiences, and our choices. Heart attack is not a matter of chance, it's a matter of choice. I am very sorry to say that India is the world capital of heart attacks. If you see here, almost 30 lakhs people in India fall victim to heart attacks. And nowadays, premature heart attacks in 30s, in 40s, they're getting heart attacks. And if you see in Delhi, almost we see 100 patients get a heart attack almost every day. That means one heart attack is happening every 15 minutes and 4 heart attacks every hour. So what should we do? We all should have an awareness about mission attack, heart attack. If you see doctors will do it, no, we are mistaken. Public has to come forward. We have to understand what are the symptoms of a heart attack and what we should take in the time of emergency. Immediately take a pill like statins or aspirin or clopidogrel, and also we must take fourth pill, what we call as a statin, as per the advice of a doctor, and ask for an ambulance very close to your hospital. Immediate ECG and drop I. Confirm the diagnosis by sending the ECG to the Heart Command Center and take a clotbuster treatment. And immediately after clotbuster, you are subjected to go to the cath lab and have an angiography, and if angioplasty is required. So what is the solution for India to have a healthy heart? The solution is primary prevention, secondary prevention, tertiary prevention, prevention. Number 2, predictive cardiology, early detection and timely treatment. I have covered almost everything. So we must have focus 25% on primordial, 25% on primary, 25% on secondary, and 25% on tertiary. Thank you very much for giving me this honor. I must say today, with a great deal of confidence, longer is the waistline, shorter is the heart line. Is use your heart or lose your heart. Move it or lose it. These are all the important methods which we must follow. We must act locally, vocally, and impact globally. स्वास्थ्य दिल Swasth Bharat, Swasth Sansar. This is my last message. Healthy heart is healthy India and healthy world. Thank you very much for giving me this honor to say a few words on the occasion of World Heart Day. Thank you.